So what's novel in the MPNs, right? So I'm hoping we are moving more into the targeted area, where the biggest breakthroughs and booms on EHA or last edge were the calreticulin monoclonal antibodies, where we have first in human data in ET and myelofibrosis on the INSIGHT study, the INCA 909, which is very, very exciting. So these new data and updates from Claire Harrison presented at EHA will also show us how does this responses look like in myelofibrosis patients, which already were presented 6 months ago with a very promising and compelling responses in spleen symptoms and anemias. So that's a very, very breakthrough, something to watch compound, and they're more into the space and hopefully more data shown in patients. I do see there's going to be a role for all of these antibodies for different patient population, and our next goal for life would be to kind of more discover and prognosticate who would be better fitted with what and in what line and what sequence. And then we had interesting novel mechanisms, right? There's a lot of effort into which molecules work in MPNs, what's responsible for disease modification, for disease progressions, and certainly inflammation, which also comes down to the interferon, plays a significant role in disease propagation. So for example, to me, very interesting was a presentation by Rebecca Schneider on the anti-inflammatory and anti-fibrotic possible novelties and discoveries of these agents. And she actually mentioned an ongoing study by the Nova group in Europe that include an agent that blocks alarmins, which is an NF-kappa-B pathway that shown a role in disease modification progressions for patients called tasquinimab. And we actually do have also that compound in the United States as a phase 1 study for patients with myelofibrosis, with a little bit of a broader arms for patients that would be on JAK inhibitors as an add-on, patients without JAK inhibitors but having need for therapies, as well as refractory and failed. So I'm really looking forward to see these novel mechanisms. I'm pretty positive they won't be working as a single agents. So the combinations, how to better design them, where to put them, I will hope they will fulfill our goals of modifying MPNs in 2026 and beyond.